I'll be your student nurse today. Can you tell me your name?
Hannah Klein.
Okay. Alright, I'm doing my hand hygiene here. Good. Alright. Can you tell me your apparent state of health? Like, are you a healthy?
Yep, I'm just here for a general exam. I'm pretty healthy.
And you're feeling good today?
Yes, I feel good.
Alright. And your age?
I'm 20.
And your race?
I'm Caucasian.
Okay, and a female.
Mhm.
And then can you please tell me your height and your weight?
I'm 5'3" and 135 pounds.
Okay, so that would put you at a BMI of 24. So you're within range. Under 25 is where we keep it in normal range. Alright. And then your dress and your grooming and your hygiene all look very appropriate. Alright. And then your general demeanor seems very cooperative. Your affect is animated, and your thought pattern is logical, relevant, and organized. Your speech is articulate. So your mental status is all intact and good. Your level of consciousness, you are alert, answer questions very nice. And then your orientation, so can you please tell me your full name?
Hannah Aurelia Klein.
Alright. And where are you right now?
In the TV lounge.
Okay. And then what day of the week it is and what time?
It's Thursday around 6 o'clock.
Okay, very good. And then what is this about? Why are you here right now?
Just for a physical exam.
Good answer. Alright, so you're oriented times 3. Now I'm going to review your intellectual capacity. So, for remote memory, who was the president prior to Biden?
Trump.
Okay. And what's my name?
Claire.
Okay. Can you interpret for me what the phrase, one in the hand is better than two in the bushes?
It's better to have something for sure than to take a risk and maybe not get it.
Good answer. And then how did you dress today? Looking at the weather.
I had a rain jacket and an umbrella.
Alright, so that was very appropriate judgment. Okay, moving on to vital signs. Out and back. I'm just going to stick it in. Alright, and 98, so good temperature. Set that there. Your pulse ox we're not doing, but I will check your pulse and your respirations. I can do this side. And can you elevate it there, please?
Mm-hmm.
Good. Alright, so your pulse was 70, so that's good, within range. And then your respirations were 18, so that's very good. Alright, and then do you have any pain right now?
No.
No? That's good. Okay, and then I'm just going to take your blood pressure, and do you know about what it is normally?
I think it's 115.
Oh, okay. So under 120 and less than 80?
Yes.
has a good blood pressure. It was 110/64. And I'm going to examine your head. So your shape is appropriate and atraumatic. Symmetry, symmetrical, everything in line on your head. Your hair is evenly distributed. And I'm going to feel just to see how it's like attached and everything. Okay. Yes, it's firmly attached to scalp. And then I don't see any, looking at your scalp, I don't see like any scars or lesions or anything. No bumps. I didn't feel any. No, so that's good there. Alright, and so now I'm gonna examine your eyes. Could you please look just straight ahead? Alright. And then I'm going to see that they're appropriately aligned. That's good. The prominence, appropriate prominence in both pupils. Alright, and now I'm going to do the perla. Alright. So, yeah, just keep staring straight ahead. I'm going to look. Good. Good on that side. Alright. Yes, you had good reactivity. They were like equally round and reactive to the light. And then I'm going to have you, for accommodation, can you look, yeah, just keep staring ahead. And then I'm going to hold this pen, and as it approaches, to see how your pupils accommodate. Good. Yes, so they constricted and had ocular convergence, so that's the right assessment. Alright, and then now I'm going to assess your EOMs, extraocular movements. So could you please, you just track where I move my pen, okay?
Okay.
So I'm going to start here. There. Good. Yep, that was all intact. Alright, now I'm just going to look in your ears. Alright, so they're symmetrical, and I don't see or feel any lumps at all on your ears. No. No lesions, negatives for scars and deformities. Yeah, I don't see any. And then your gross hearing seems grossly intact. Do you have any
I don't hear
type
any
of
loss.
hearing loss? Okay. And then now I'm just going to shine my light in and make sure everything looks good inside. So I'm going to hold it up, out, and back. And I'm just going to examine in there. Good. And I'm going to do that on the other side. Up, out, and back. Good. Yeah, so everything is clear and intact in there. Okay, and now for the nose, I'm going to examine, do you have any like allergies or like any congestion, anything?
No.
No? Okay, and then breathing, do you have any difficulty breathing out of your nose?
No.
And then smell, do you have a hard time smelling any like odors?
Mm-mm.
No? And then for drainage, any drainage?
No.
Okay. And if you wouldn't mind just putting your mask. Alright, and then going to look. Make sure everything looks good. Good. Yeah, I didn't see any drainage. Your breathing, I felt normal. yeah, everything looked good. Mucous membranes were pink and moist and intact, no drainage or blood. So that's good. Throat. Alright, so would you mind just like opening up and sticking your tongue out? I'm gonna look in there. Good. Yeah, so it's pink and moist. Everything looked intact. No lesions I didn't see. Your teeth were good. Good dentition. And then odor, nothing out of the ordinary. It smelled fine. And then your gag reflex, I'm not gonna do, but if I did, I would just hold a tongue depressor down and on your tongue, and then push it like further back until you have like a gag reflex. All right, and then can you also swallow, and so I can just make sure everything looks right? Yeah. Okay. You were positive for swallow. And then I'm just going to feel. You can put your mask back on now, but I'm just going to feel for your tracheal alignment. Okay, so. Okay. Yeah, there was no tracheal deviation and it felt normal, no enlargement of the thyroid gland or anything. So now I'm just going to do your lymph nodes and make sure everything is good there. So here we have your pre-auricular, post-auricular, occipital, and then you have your thyroid, or your tonsillar ones there, your submandibular here, your submental under your chin, and then you have your superficial cervicals right here, your posterior cervical, and then for your deep cervical, I'm just going to knead along there like that. Everything sounds good there. And then your supraclavicular. That was all good. Did you feel any pain or tenderness when I was doing that? No. And I didn't palpate any. They were non-palpable, so that's good. And then I'm going to feel your carotid to make sure that. Good on that side. It's strong in a 3+. And then I'm going to feel on this side. That's also strong in a 3+. And it was symmetrical also. Okay, now I'm going to actually listen to it. Okay, so deep breath in and out, and I'm gonna listen. And one more time. Okay, I don't hear any bruit on that side, and now I'm gonna do it on this side. Good, and one more time. Good. Yeah, no bruit. Alright, and now I'm just going to look at your skin. Appropriate flesh tone, your arms, your neck, everything looks good. Moisture, I'm just going to feel to make sure. Appropriate moisture. Texture, it's nice and smooth. Temperature was warm to touch. Yes. And then the turgor, I'm just going to pinch right above your clavicle over here. Good turgor. And then lesions, from what I see on your neck and everything, no lesions. I'm going to inspect your precordium. Alright, looking at it, I don't see any pulsations at all. And now I'm just going to feel across the different sites for pulsations or throats. Alright, so sternal angle. Alright, so this is the aortic no pulsations, no thrills. Pulmonic, no pulsations, no thrills. Herbs point, no pulsations, no thrills. Fourth intercostal space, no pulsations, no thrills. Tricuspid, no pulsations, no thrills. And then mitral, no pulsations, no thrills. There was actually a slight pulsation because you're supposed to, that's your PMI. So there's a little faint tapping there. Alright, okay, so yeah, thrills were all negative, which is good. The PMI was in the right location, fifth intercostal space, mid-clavicular line. The rate was consistent with the vitals, and the rhythm was regular, diameter was appropriate, the fifth intercostal space, mid-clavicular line, and it was only located there. The duration, I felt the faint tapping, which is appropriate. Alright, so now I'm just going to check, listen to the sites. So, do that. Aortic. Pulmonic. Herbs. Fourth intercostal space. Tricuspid. Half step. And then your mitral, which is PMI. Okay, very good. Alright, so yeah, it was the appropriate relationship between S1 and S2. S1 was loudest at the bottom, and then S2 was loudest at the top, which is appropriate. No extra heart sounds. The rate was consistent with the vital signs. The rhythm was regular. Strength strong, no extra heart sounds, and you're good. I'm just gonna do a lungs and thorax assessment right now. Alright, so structurally you look symmetrical, no deformities, the size and shape are nice and appropriate. Alright, could you shrug up on my hands, please? Perfect. Strength is good, clavicles I'm just gonna feel across to make sure they're in line, and they are. Symmetrical sternum, I'm just going to feel down your sternum to make sure it's in line. And your sternum is in line, nice and vertical. Okay, and I'm going to do respiratory excursion. So can you please take a deep breath. Yeah, breathe in deep and let out. Okay, that was good. Yeah, so you had appropriate depth, deep, and symmetrical with your excursion. And then lesions, from what I see, I don't see any lesions. Okay, now I'm just going to listen to your lung sounds. Can you breathe in deep, but no quicker than normal? Okay. Alright, so through the 6 sites, they were all good. The rate was consistent with the vitals. Rhythm was regular. There was non-labored effort, no use of accessory muscles. Adventitious breath sounds were negative, and I only heard the vesicular lung sounds all the way through. So that's normal. And then now I'm just going to assess for your posterior one. So if you could just like turn sideways a little. All right. So scapula. I'm just gonna make sure. This over here. Yeah. So your scapulas are even alignment. Spine. I'm just gonna feel down. I'm just gonna go like this. So cervical here, thoracic, lumbar, and then sacral. And those were all symmetrical, vertical. And then, yeah, just sit up straight, please. And I'm just going to see for the appropriate S curvature. So we have a concavity, convexity, concavity, and convexity. Okay, now I'm just going to assess your transverse and anterior posterior diameter. So your anterior posterior diameter here is half of your transverse diameter here. So that is appropriate. And then respiratory excursion, I'm going to assess that again. So if you could please just take a deep breath in. Yes, so just take a deep breath in and out. Okay, that was appropriate. Excursion was deep and symmetrical. And then lesions, I don't see any lesions, so that's good. Okay, now I'm gonna listen again on your back. So if you could please give yourself a hug. All right. And then breathe through your mouth, but no quicker than normal. And like deep breaths through your mouth. All right. Okay. Yeah, so those were also good. Vesicular sounds all the way through. The rate was consistent with your vitals. Rhythm regular. Depth was deep because I asked you to breathe deep. Effort non-labored. Negative use of accessories and no adventitious breath sounds. So you're good. All right. I'm just gonna assess your abdomen, and I can tell that it's non-distended, so that is good. All right. I'm going to listen to your vowel sounds, picking one of the 4 quadrants. I'm going to do your right lower quadrant, and I'll be listening for a minute. 18, so that's good. The normal range is between 5 and 34, and you were at 18. Alright, and yeah, they were normal, nice, and strong. Alright, now I'm just going to percuss across your abdomen to assess for like tympani. So, I'm just going to do this. Yeah, so the tympani was good, regular tympani all the way around. And now I'm just going to see for, I'm just going to like palpate and tell me if you feel like any tenderness or anything. Yeah, I didn't feel any lumps or lesions. I didn't see. I'm just gonna look. Don't see any lesions there. And no like organomegaly. Did you feel any tenderness or no? That's good. And then, and I'm not going to go like as far as like your bladder to assess for distension, just for modesty, but your abdomen was non-distendable, which is how it should be. And we're not doing the genitalia exam. Moving on to musculoskeletal, would you mind just sitting up and swinging your legs over? Okay. Do you have any like joint pain at all?
Mm-hmm.
No. And I don't see any like deformities across your joints at all, in your muscles or in your bone structures at all. Do you have any like stiffness or decreased range of motion at all? No, that's good. So your range of motion is grossly intact. And then crepitus, do you notice like any creaking or like crunching in any of your joints? No. All right, so there's no crepitus negative, that's good. And then moving on to your extremities, I'm just going to look at your arms. Yeah, you can just relax them like that. And your legs, that's good. Everything looks good. I'm gonna see your color, appropriate flesh tone on your arms and on your legs too. And now I'm just gonna feel for your temperature. It should be warm. And then can you flip your palms? All right, that was warm, how it should be. And warm, yeah. So temperature is nice and warm. Pulses, I'm just going to feel the pulses. Yeah, just flip them like that. And those are very strong, that's good. Strong 3+. Pulses symmetrical, and your shoes are off. So I'm just gonna feel your pulses on your dorsalis pedis. I'm gonna feel. And that's strong, 3+ and symmetrical. And then and then it's your posterior tibial, which is right by your ankle. I'm just gonna feel. That's 3+, strong and symmetrical. So those pulses are all good. Okay, and now for your capillary refill, I'm just gonna pinch here. So blanching, brisk capillary refill on your thumbs, your middle finger, blanching, brisk capillary refill, and then on your pinky, brisk capillary refill. And then would you mind taking your socks off? Okay, since you have nail polish, I'm gonna go on your skin around your nail. Blanching and then brisk capillary refill. blanching, brisk capillary refill, and blanching, brisk capillary refill. Those were all good. Edema. So I didn't see any edema on your hands or your feet. I can see like your tendons, your knuckles, and then your bony prominences also on your feet. I can see your tendons, knuckles, and all of that is good. So negative for edema. All right. Oh, now we're gonna assess your neurological health. So, okay, I'm gonna reach over, and can you squeeze my hands? Good. Can you pull towards you and push towards me? And then I'm gonna do the same for your legs. So can you push towards me and pull towards you? Good. All right, so yeah, you had good grip. And then you also, your upper and lower extremities were both appropriately strong, so that's good. Coordination, could you please just walk regularly normal to the couch and back? Okay, that was great. Coordination, it was appropriate. And then for sensation, do you have any difficulty like feeling hot or cold at all? No, that's good. In your upper or lower extremities? No? Alright, so you have appropriate sensation. Your sensations are grossly intact. And then now I'm going to assess some reflexes. So could you please, with your right arm, can you make a muscle? Okay. And now relax. Good. I saw some movement in your fingers, which is appropriate. That's the reflex for your biceps. And now I'm going to assess that on your other arm. So can you make a muscle? All right. And then relax. All right. Okay, I did see some movement also on that hand, so that's appropriate. Good reflex. And now for your patella one. Just relax your legs. I saw a reflex there. Good. That was also good. So you have like bilateral reflexes, which are appropriate. And then for your short-term memory, can you remember what was my name?
Your name is Claire.
All right, that's appropriate. All right, that concludes our exam.